Hello, everyone. It's Dr. Gupta at the Dermatology Laser and Bang Center, and we're going to talk about jowls because this is a very common problem that patients come in to see us for. So, jowls can occur even at an earlier age, and as you get older, they might actually start to get worse because we are losing collagen in our skin, we're losing that elasticity. We are also having more weakness in the muscle itself. So it begins to just want to sag a little bit. And of course, we also have bone loss, fat loss. So a lot of things actually contribute to the formation of the jowls. One of the simplest things we can do sometimes is actually use a little bit of neurotoxin, especially when a patient has sort of this downward frown expression, and it works like magic. I mean, it really does an amazing job. Sometimes if someone is having the jowls because of a movement issue related to the lower face, so a little bit of neurotoxin in this depressor angularis muscle, and then we will also sometimes add a little Botox to the chin to prevent sort of that uplift of the chin and the downfall of the corner of the mouth together. Sometimes we can even place a little neurotoxin along the jawline, especially if you tend to have bruxism or you're grinding your teeth or have a lot of tension in that area, and it can give a little bit more of a chiseled appearance. We can also add a little bit of volume along the jawline, so a jawline filler with products like Radius or like biostimulatory fillers are a great way to address getting a more snatched jawline in a very simple and quick way, and it can certainly be combined with the neurotoxins as well. Sometimes you have to add the volume to the upper face to actually bring everything upwards. So if I notice that you're starting to have volume loss in your temples or upper cheek area or the sides of the face, then adding a little strategic filler in those areas can make a dramatic difference to your jowls and to your jawline. And then of course you have the energy-based devices that help to re-stimulate your collagen, tighten the SMAS, and we can do this. A lot of the procedures are actually non-invasive and non-surgical, so procedures like Ultherapy and thermage, and then also procedures like M-phase are just amazing for helping to shrink that muscle back up and also tighten the SMAS at the same time. And sometimes we combine these procedures just depending on what we're seeing clinically. Procedures such as skin resurfacing procedures using the CO2 laser or our Cyton erbium laser, and then also sometimes we'll use threads to actually literally lift the skin up, and these threads are usually made of PDO, which is a dissolvable material, but it has little anchors on it. So as we place it under the skin and pull them back, it just kind of anchors the skin back up, and over time it's going to help stimulate new collagen and keep that tissue kind of bound together underneath. So there are a lot of different ways to address that. Of course, we also do facelifts, and that can be a great resort for people who just want a more dramatic result immediately, don't want to try other methods. And sometimes we'll do the facelift and still combine it with other procedures to get the best outcome, because a facelift, for example, may not address movement issues or volume loss, but it will get rid of the excess skin and also help to tighten that muscle back up. And then we can do procedures afterwards to preserve the integrity of the skin, keep that collagen stimulated, and still continue to help you age your very best possible. And then there's also RF microneedling, which is another procedure sort of like microneedling, except for placing the needles under the skin, and it's delivering that dose of radio frequency, which is energy based. So it's also going to cause contraction in the skin and also help with like textural improvements of the skin. So that gives you a good overview of what's available for getting rid of the jowls. It can be as simple as some injectables or as complicated as surgery or anything in between or a combination. And again, like, it's so individualized. You really need to see what's the quality of your skin, what's your age, you know, where are we with movement, with volume loss, and then we can come up with like a really good plan that's going to give you either an immediate improvement or maybe an improvement over time. So thank you so much for watching, and do let us know if we can help answer any questions, and we would love to see you.